Again, this ESMO was a great meeting when it comes to gynecological cancers. We had some very interesting, intriguing data coming up. Especially, I would like to point out that there were long-term benefit data from the first-line PARP inhibitor trials, all three of them. One was the data, overall survival data of SOLO-1. The other was overall survival data of PAOLA-1, and the last, the long-term PFS benefit and PFS2 benefit of PRIMA. So SOLO-1 was not mature for the overall survival because the results are so positive. It is not matured yet, but you can already see at 7 years follow-up, there is a tremendous benefit with a huge difference in patients who receive placebo for 2 years or active olaparib. So that is very encouraging. When it comes to the PAOLA-1, where patients receive bevacizumab with olaparib versus bevacizumab, again, you see survival benefit in these patients who received the doublet. So again, proving that 2 years of olaparib together with bevacizumab improved survival of the patients compared against bevacizumab alone. And PFS, the OS of PRIMA trial is not mature. Only 38% events are there. We need 60% events. So it may take a couple of years probably. But the data we saw, the long-term PFS data and PFS2 data was again similar to what we saw in the other two trials. Very encouraging, clear separation of the Kaplan-Meier curves showing long-term benefit. So I think this was the biggest news we had at ESMO this year.